So hi, good evening everyone. Okay, so hi, good evening everyone. Let us start with this session. So I welcome you all to Unacademy. Yeah, hi. Okay, surgery vibes. That's great. What a name. So before that, let me tell you about some great things going on at Unacademy. So first of all, you know about the iconic subscription where you get Unacademy and Prep Ladder, and we have a lot of batches already started for you all. So if you are aiming to crack the FMG or NEET or NEXT, this is the right platform for you, and we have right batches at right time for you. So let us just start with this series. Okay, so come on, this is the first question. Hi DK. So this is the first question that we have. Identify the incision made for a fibroadenoma in the breast. So there's an incision. I hope you can see the incision also. This is the incision, yeah. So what incision is this? What incision is this? Naveen, hi, good evening everyone. So this is a question on the incisions. Okay, let us see. This is a very simple, straightforward question. What is fibroadenoma, students? Fibroadenoma is a benign condition. So whenever you are planning anything for a benign condition in the breast, the first and the foremost priority is the cosmesis. Yes or no? So cosmesis is of paramount importance. So let us just start this session with some interesting content. Just a minute. Okay. So when we talk about the incisions for the breast, whenever we talk about the incisions for the breast or breast incision, the first very important thing is why we are making. What is the purpose? Yeah, the purpose you have to define as either it could be for the benign breast diseases. So either it is for the benign breast diseases, or students, it is for the malignancy. So if it is for the benign breast diseases, the aim is not only resection, the aim is to conserve the cosmesis. So the aim is purely cosmesis. You want to get rid of the disease also, but you don't want to alter the cosmesis. When you talk about the malignancy, the aim behind making an incision, yeah, is the exposure. And not only exposure, why do you need this exposure? Because we need to define a good clearance also. So exposure and clearance, they are of paramount importance in this condition. Now, when we are talking about the benign breast diseases and when we want to conserve the cosmesis, what are the incisions that we make? We try to make incisions such that they are hidden under the what natural contours. अब ये कौन से होते? Let us see. We can make a circumareolar incision. We can make a circumareolar incision. And what is this incision better known as? This incision is better known as a Webster's incision. Remember, there is a Webster's flap also which we use for lip reconstruction. We also have inframammary. We also have inframammary incision. When we talk about inframammary incision, what is that? There is an incision which is known as Gallard-Thomas. There is an incision which is known as Gallard-Thomas incision. So this is what is very, very, very important. So circumareolar and Gallard-Thomas. When we are talking about circumareolar incision, if this is the breast, this is the nipple areolar complex. The incision is made along this nipple areolar complex so that the scarred incision site is hidden or it mixes with the corrugated texture of this nipple areolar complex. So this is the Webster's incision that you make. Again, the another one is along the inferior mammary crease. So you lift up the breast, you make the incision, and this is what is known as Gallard-Thomas incision. Gallard-Thomas incision. Now, when we want the maximum exposure, what is the prime thing that we have to understand? We make what? Elliptical incision. So it can be elliptical transverse incision elliptical transverse incision, or it can be elliptical oblique incision. So elliptical transverse and elliptical oblique, there are two variants. So elliptical transverse and elliptical oblique. One very important thing that you all have to understand, that what is elliptical transverse. Suppose this is the mass and this is what is elliptical transverse incision. This is also known as a stewart incision. And what is elliptical oblique? For upper quadrant tumors, we might make incision like this. This is what is known as elliptical oblique incision. So we have elliptical transverse and elliptical oblique, and this is what is known as OR incision for upper and outer quadrant tumors. So if you see this incision, what kind of incision this is? This is a classical inframammary or Gallard-Thomas incision. Now I'm going to ask one more question in this question. Question number part B. This is part B. Again you will answer. Yeah. What suturing technique has been used? So what suturing technique has been used? Point number one. The second important point is what suture is ideal for this technique? Come on, students, answer. What suture is ideal for such technique? Come on. So what suturing technique has been used and what suture is ideal for this? Come on. What suturing technique has been used? Anyone? So very good, Maria. Very good, Maria Bashir. So we have subcutaneous. If you see the tract is undermined. Yeah, the tract is undermined, and where it is undermined into the what? Dermis, at the level of dermis. So if you see, this is something like this. Yeah, on one side you are able to see the suture, and then you are not able to see the suture line. This is what is subcutaneous technique. Yes, subcutaneous. So this is a subcutaneous technique, subcutaneous suturing. Now what is the ideal suture for this purpose? What is the ideal suture? The suture that we use, answer is polyglycapron. So it should be absorbable. Very good. So polyglycapron. What is polyglycapron, students? It is marketed by the name of monocryl. 90 to 120 days. 90 to 120 days is the days of absorption. And this is a monofilament undyed suture. Undyed suture. So there is no typical color of this, or even though the packing has a typical orange color, but the suture is undyed, and this is what is monocryl. Where do we use this subcutaneous technique? Where cosmesis is of paramount importance. What are the sites? Like thyroid, like breast, like phalansteal incision that we classically make for LSCS or other genitourinary surgeries. Is that clear or no? So let us move to the next question. Okay. Identify the electrosurgical unit shown in this image. Identify the electrosurgical unit shown in this image. Come on, tell me. Come on, tell me. It's easy, very easy. Identify the electrosurgical unit shown here. Very good. This is a case of bipolar. Why it is a bipolar? How can you define this bipolar? Let us try to understand. Why it is a bipolar? Try to understand this. This is a unit. Yeah, this is a unit. And then, what is this, students? What is this? Both the electrodes. Can you see the two electrodes? Both the electrodes are in the hand of what? Consultant. Yeah. So electrode number 1 also, electrode number 2 also. Both the electrodes are in the hands of what? Operating consultant. There is no patient plate. So therefore, this is a what type? This is a bipolar. Had it been something like this, try to understand. Had it been a single electrode, now tell me, with a plate attached here, now tell me what is the answer. Now tell me the answer. Now tell me the answer, what it is. If this is the scenario. So one cable is taking the current in, and the another, this is the second electrode. This is the very good. This is the second electrode. The second electrode is accepting the current and returning it back, and this is making the circuit. So this becomes now the monopolar. So monopolar and bipolar, you have to understand, because there is completely different technology. When we use monopolar, when we use bipolar, I'm going to explain it in detail and depth to all of you. Bache, the answer, when do we use monopolar? Monopolar is actually used for sealing. So it has a sealing action. It has a sealing action. So sealing the vessels. The use of bipolar is to seal the vessel. It cannot cut. Bipolars cannot cut. We require a special scissor or maybe a blade to cut. Bipolars are not going to cut. Is that clear or no? Bipolars can only seal. So let us see something about the modern days electrosurgical units and how they function. So this is a very, very, very important topic for all. So let us start this healthy discussion on electrosurgical units, ESUs, electrosurgical units, electrosurgical units. Now when you talk about electrosurgical unit, the first in this is, let us talk about energy based, or you can say the current based, and the ultrasicon based. What is ultrasicon based? What is the ultrasicon based? Answer is, ultrasicon based is your harmonic scalpel. Harmonic scalpel. So we have harmonic scalpel. And current based, we have monopolar and bipolar. Monopolar and bipolar. Monopolar and bipolar. When we talk about monopolar, bipolar and a harmonic technology, what is the difference? Let us see. In monopolar, if you talk about, you have a single electrode connected with the patient and one electrode is in the hand of the surgeon. Bipolar, both the electrodes. But ultrasicon, if you talk about harmonic scalpel, this is not current based. It utilizes the ultrasonic energy. It utilizes the ultrasonic energy to cut and seal. To cut and seal. Yeah. Now when we talk about monopolar, monopolar versus bipolar, both electrodes are in one place, and therefore no concept of current dissipation. And since there is no concept of current dissipation, what is the beauty of this? But say, where do we use? We use it when we are operating near the major vessels, like you are doing a neck surgery, you are operating near the carotids. So you fear that current might disrupt and perforate the vessel. So current disruption, therefore it is used for important vascular surgeries. Yeah. So no lateral, or you can say remote thermal injury, no remote thermal injury. Whereas the remote thermal injury is a big drawback of bipolar, of monopolars. Okay, let us talk about the monopolar technology. Monopolar technology can cut as well as seal, can cut and seal. What is another important property? One electrode is in hand of surgeon, and therefore the current has to travel through the body. Get harmonic scalpel और वो सब ले आना जरा, मोनो harmonic scalpel और Marseille 5, ठीक है, bipolar और monopolar के instruments लेना. Okay, so let us see the concept of this, because I've asked my OT assistant to get some instruments so that I can show them to you, because there are a lot of students who are always confused between monopolar, bipolar, yeah, and then harmonic scalpel and ligashore. Video is not clear, you can just refresh or check the, you can say, the settings. Is it clear with all? Video is clear to all? No. So when we talk about the monopolar, what is the concept, how the monopolar is working? Monopolar has two modes. Now you will tell me what color is represented by for cut and what is the color for the coag. So color coding, tell me the color code. The color code is, we have yellow for the cut, and blue for the coag. Students, is the video not clear to all? Next is, but we get a question on the current kinetics and voltage also. So voltage for cut, always remember the voltage is kept low, and for coag the voltage is kept high. Then is the current frequency. So when we are talking about the frequency of the current, it is high for cut, and low for coag. What is the mechanism, the concept you have to understand? Let us all understand this, because students, we get a lot of questions on this this mode. So just see, this is, if this is the tissue, and this is the, if this is the tissue, the current is concentrated on the tip. And it goes. And how it goes? It goes in high frequency, low voltage. So bache, high frequency results in ionic turbulence. So high frequency causes ionic turbulence, and because of this ionic turbulence, what is going to happen, students? Yeah, there is collision, and there is generation of steam, When there is generation of steam, what will happen? Therefore, expansion of the tissue, and when there is expansion of tissue, the tissue will burst like a what? Bomb blast. Yeah, and therefore the tissue blasts off. So there is tissue blasting. Are you getting this concept up till here or no? Are you getting this? So there will be tissue blasting. The next very important thing that you have to understand, bache, pure cut therefore is the most devastating of all. What is concept of pure cut? If you press the pedal for 3 seconds, the current will be bombarding or blasting the tissue for the next 3 seconds. So pure cut means 100% on. So if you press that button, for these 3 seconds, it will be cutting and disrupting the tissue. Therefore, we are always advised to use the blend mode. What is the concept of blend mode? You are going to blend the on cycle with the off cycle. What do you mean by blending on with the off? Answer is 50% you will blend 50% on and 50% off. That means it is far safer than the pure cut. Then blend 2. What is that? 40% on, 60% off. Blend 3, 25% on and 75% off. This is how we have blend 1, blend 2, blend 3. Blend 1, blend 2, blend 3. Is that clear? So blend 3 is the safest of all. When you talk about the mechanism of the coag, what is the mechanism? The current flows in low frequency but high voltage. So do you know, because of the high voltage, there is melting of collagen, and when there is melting of collagen, as the melted collagen could have converted into steam, but say the current goes off. So because of the low frequency, the current is off, and therefore this collagen cools. So there will be cooling of collagen, and once there is cooling of collagen, what will happen, students? This will re-solidify, and when it re-solidifies, this is going to result in a scar. Now this is a big mistake that there are many people. So when you heat a tissue, the pink color of the tissue changes to what? Hash brown in color. If you keep on heating it again and again, there are some people जिनको कीड़ा होता है कि yes, blend mode is also used to cut. Yes, to Surya, it's a cutting mode, but it is safer. Yeah. So what happens if you keep on burning the tissue again and again? There are people who want to achieve better hemostasis, and that is why keep on burning. What will happen? There will be what formation? Can you see? This is what is known as charcoal formation. There is a charcoal formation, and once there is charcoal formation, the tissue will start, there will be rebleed. And this is what is the technology which is not there in cases of harmonic scalpel. Yeah, video is not clear. I think from my side everything is clear because I am seeing on my phone also. It's absolutely clear. I think you need to just check your power, your internet settings. So, bache, you must have heard of an instrument which is known as ligashore. Have you heard of? I hope most of you must have heard of ligashore. I hope most of you have heard of. So, what is that concept? But there is nothing known as ligashore. It's a brand. Ligashore is a brand. Let us talk about vessel sealer device. Let us talk about vessel sealers, or let us talk about smart bipolars. Smart bipolars. बच्चे इसकी बहुत सारी brands होती हैं या we have ligashore, we have Enseal. So ligashore is from Covidian, Enseal is from what? Johnson and Johnson. Like I prefer to use Marseille. So again, they're very good. They're very good brands. But there are instruments. So what is the difference between this and a conventional bipolar? But they are smart bipolar. So they are a bipolar with a chip, to sense the tissue moisture. So they are a smart bipolar to sense the tissue moisture. And what is the great thing with them? Yeah, they will sense the tissue moisture, and therefore, as the moisture desiccates, as the tissue moisture desiccates, they will break the circuit. So there will be breakdown of the circuit. What is the advantage of this breakdown of circuit? There is no what formation, therefore no charcoal formation. No charcoal formation. Are you getting this point or no? This is what. Then at last, I'll just simply revise with you again what is the concept of harmonic scalpel. Harmonic scalpel. And then I'll show you the instrument also. So when you talk about harmonic scalpel, if you see this instrument, this is something like this. There are two different jaws, and then this machine is something like this. Yeah. This is how the machine is. There are two buttons. One is for maximum power setting and one is for minimum power setting. But behind this, you have a transducer which is attached. So this is the transducer which is attached. So this is the transducer that is attached, and then we have lower blade. Do you know lower blade or lower jaw? This is active jaw. This is active jaw of the instrument. Yeah, and this is made up of piezoelectric material. Piezoelectric. So this is piezoelectric. And do you know this is vibrating forward, backward like a saw. So vibrates. So vibrations in the multiples of 11,000 hertz. 11,000 hertz. So into 1, into 2, into 3, into 4, into 5. That means up to what? 55,000 hertz. So it keeps on vibrating. Do you know that at pressure, at power settings, at power 1, 2 and 3, it has the sealing action. At power 4 and 5, this is having a cutting action. Whereas the vessel sealer can only seal. Are you getting this? So it can only seal, it can seal plus cut. If you see the upper jaw, upper jaw is inactive jaw. This is inactive jaw. And always remember, this is made up of Teflon. And what is beauty of this jaw? This will not allow the tissues. To get damaged by passing of the what? Vibration. Now I'll show you some instruments. Try to understand. Like I have an instrument in front of you. Try to see this instrument. What is it? It looks like a conventional Maryland forceps, but it is not a Maryland forceps. Let me try to change the camera settings. I hope it is visible here. So this is a Maryland. If you see, this looks like a Maryland, but it is not a Maryland. Yeah, it's a bipolar Maryland. Can you see how do you identify it's a bipolar? Just see, there are two jaws here. there are two poles. One is this electrode, one is this electrode, and one is this electrode. So there are two electrodes. I hope that's visible. Yeah, there are two electrodes in this. Conventional monopolar has only one end, whereas a bipolar laparoscopic instrument has two electrodes, one on this side, one on this side. This is a monopolar. The jaws look like same, but can you see the orange insulation sheath? The orange insulation sheath is very important. Very important. Try to understand this. I'll change the setting. Just wait. I'll just change the setting. Just wait. Okay, can you see this? Can you see on this now? Can you see this now? Okay, so this is how. There are two electrodes. Now, let me show you what is a harmonic scalpel. Just see, in a harmonic scalpel, both the jaws are different. Can you see? Both the jaws are different. The lower jaw is a sharp metallic jaw, and this is what is a piezoelectric jaw, and this is going to cut. Why this is known as student scalpel? Because it can, if you just touch the blade with the tissue, it can keep on cutting. Why this Teflon is needed? Because if this Teflon is not there, the vibrations from this jaw will pass to the nearby structure and will damage it. So this is a harmonic scalpel. How do you identify? This is the blade. This is the blade, and this is the inactive jaw. But if you see the instrument, this is hollow from back. Give me a vessel sealer. So I'll show you how a ligashore or a vessel sealer looks like. If you see a ligashore or a vessel sealer, both the jaws are same. Both the jaws are same. Can you see? Both the jaws are same. In contrast with this instrument, where the lower jaw is metallic and upper jaw is Teflon, here both the jaws are same. There is no ultrasonic transducer which is attached behind, and this is what is very important. Are these points? DK, are you able to see now? Yeah. Now the next important point is, sir, that means, like, if I am operating with this instrument, yeah, if I am operating with, this is known as a Ruby's dissector. This is known as a Ruby's dissector. Can you see the difference? But there is one electrode. That means it is a monopolar instrument. This is a bipolar instrument. Ab dekhte jana. That means if I am coagulating a vessel, I am pressing it, I have coagulated. Now I want to cut it, so I will have to take this instrument out, again insert a scissor and divide it. What is the advantage in this? This is also a bipolar. In order to reduce the time of taking out the instrument and cutting, we have a blade. Do you know this blue button is actually the button which will activate the bipolar? This red is a manual cutting blade. You will see when I press this red, there will be a blade which will come out. Just try to see. Can you see this blade? In between the two jaws, there is a blade coming out. Just try to focus on this blade. Can you see a blade now? Okay. Just see this blade. Can you see the blade in between? In between, like a snake has a tongue out, that hissing action of snake. Na? Just see. Can you see in the middle? A blade is coming out? Yeah, blade. This blade is very important. So what happens when I'm doing laparoscopic hysterectomy? I'm sealing the uterine, suppose, and then simultaneously I'm pressing it, cutting. I don't have to take out the instrument, again reinsert. Now when you talk about this is a ultrasonic transducer. This is an ultrasonic transducer. Yeah. So we have a lot of types of harmonics. I have already shown you. If you want, I can show it again. But if you don't get the bigger instrument, if you get a small instrument, how to identify? Because these are all very costly instruments. So they're not available in every center. Most of the centers, they keep you the bigger harmonic. So what is this instrument? This is a small harmonic. Many a times you see this, you think that only this kind of instrument is a harmonic. No, but this is a laparoscopic harmonic. This is a harmonic of open surgery. How to identify? If you see both the blades same, yeah. So can you see, this is a metallic blade, this is a Teflon. So I prefer to use it for what? Abdominal dissection sometime, or especially I use this last time मैंने इसको use किया था in thyroidectomy. Yeah. Then we have some larger also. Can you see, when you are operating in pelvis, you are not having that much of, you can say, depth with this. Yeah, you can use this. This is also harmonic focus. तो देखने में सब अलग अलग इंस्ट्रूमेंट है, कैसे आइडेंटिफाई करना है? The place behind this is empty because here you have to attach the ultrasonic transducer. Then here this is the active jaw, and this is the what? Yes, inactive jaw. So this is what that you have to remember about the harmonics and the different things. I hope these things are clear. You understood something, कुछ समझ में आया? Yeah. So if you see, the answer for this is a bipolar. Yeah. Answer for this is a bipolar. So this is all for today. This is all for today. And we meet tomorrow again. Every day I will take a small session with you every day at 7 o'clock so that we can sit together and enjoy. If you really like the class, do join the plus course. Use the code Surgery Live. You can also use the code Dr Dixit. And please do follow me on Unacademy so that you don't miss notification of my classes. Yeah? On lab, Surya, yeah, ask. Yeah, this is a laptop class. Good day. Surya, you can ask your doubt. Up. Yeah. After this, at 7 o'clock. At 8 o'clock, I have a class. Yeah, I'm doing this MCQ based discussion only. Dekho, try to understand. There is nothing like solving 10,000 MCQs. You have to solve certain decent amount of things. Yeah. But say the concept is to ask MCQ, to discuss one MCQ, and then discuss the concept so that you may be able to answer n number of questions which can be asked from that. So, but it's pointless discussing 15,000 MCQ. So I always take up MCQ and then I prefer to discuss a topic. So I hope you enjoyed. We meet tomorrow. We meet again. Till then, stay safe and keep on enjoying at Unacademy. Do recommend Unacademy to your friends and share the links of the class. Do comment how did you like the class.